Good evening and welcome to the show. I'm Larry Bruhard and I'll be your host this evening and every evening in the future for public good. We try to identify corporations, institutions, and individuals who do good things and do them well. And tonight we have a very special guest, Dr. Arturo V. Estuita. He's been a medical doctor since 1964. He's a practicing internist, preventive medicine specialist, and the founder of the Philippine Society of Chelation Therapy. He's also the founder of Friends of Chelation, a co-founder of the Philippine Anti-Aging Medical Society, and an awardee of Who's Who in the Philippines. Dr. Art, thank you very much for coming this evening. Could you start off by just telling us a little bit about yourself and what you do?
Well, actually, I want to be known more as a preventivist. I love teaching people how to prevent illness, especially illness that are very expensive and dreadful. No? As an internist, I like the prevention of most of the diseases that kills people, especially the heart and the brain attack, hypertension, diabetes. And because I'm an internist and the body does not only consist of the brain and the heart, I also teach the public about the prevention of quite a lot of diseases. Because I always believe that prevention is education, information, and information is prevention. This is the thing that I do. So this is my advocacy for the past many years. But then in my clinic, I do practice the treatment of disease of the heart in the brain without surgery.
And how did you come to do this? You started off as a regular doctor. How did you move on to?
You know, actually, I was trained by 4 American mentors. But then after about 15 years of practice as a conventional doctor, I found the failure of conventional medicine. I was then in a beach at one time. We call it Mahal na Araw. It was a vacation. And it occurred to me a question: why is it that for the past many years that I had been treating patients, the statistic of killers, diseases had not changed at all? Heart disease was number one. It's still number one now, 15 or 17 years after. Number 2 is stroke. Number 3 is cancer. And as I said, the number 4 is multiple or polypharmacy. So what I did was...
I didn't hear multiple...
multiple medicine or polypharmacy. And so, you know, even if my vacation will take about 3 or 4 days in the beach, I told my family that I'll have to go home and make a self-imposed protocol to really study what is wrong. And you know, I found out that there are so many wrong things that I turned my back to the many years that I have trained for, especially in chronic degenerative disease, this thing that I have mentioned. So, in the study of these diseases, I found out that there are not only about 9 to 10 causes, but I discovered 21 other causes. So how will you be able to cure when you are only dealing with 9 causes? No? And the sad fact is, I discovered that one of the frequently blamed culprit, which is cholesterol, is not actually the cause. No, it's not actually the cause. So how will these dreadful diseases be licked? It cannot be.
Can I ask, how did you decide that cholesterol wasn't the cause? Because that's what we hear from everybody today.
Exactly. Now, there are scientific and practical explanations to this. Number 1, arteriosclerosis can start from birth up to, say, as early as 15 to 19 years old. There is already beginning arteriosclerosis. And these people does not have high cholesterol level. You will not see a child that was born with high cholesterol. You will not see that. Number 2, you know, the circulation is made up mainly of 2 blood-carrying structures. The artery develops arteriosclerosis, while the vein does not develop arteriosclerosis. Now, the vein contains the same amount of cholesterol as the artery. Why is it that it does not develop arteriosclerosis? Because cholesterol is not the cause. For practical reason, everybody, every patient knows, the public knows, that we get blood from the vein to determine the amount of cholesterol we have in our body. Now, the same amount is in the artery. But why is it that the vein does not develop arteriosclerosis? And I talk with pathologists, I talk with all cardiologists. They know that there is no arteriosclerosis in the vein. But it contains the same amount of cholesterol. If it is high in the artery, it is also high in the vein. But why is it that there is no arteriosclerosis there? Because the reason is it is not the cause. It is not the cause. No. In fact, I'm so worried if you treat the cholesterol as a cause. You know, they say that it should not be higher than 200 total.
Right.
And the LDL, which is the bad boy, should not be more than 100. But you know, to treat this is even dangerous. The American Journal of Medicine says that it may cause cancer. Many of this medicine for cholesterol to lower it down.
Okay.
Now, number two, since cholesterol is an ingredient, it is a component of the development of our male hormones.
Okay.
No, the testosterone, which, by the way, males and females have testosterone. No, if you lower the cholesterol, then your ingredient for the development of this hormone will be low. There will be none. In fact, if you will lower it at 160, 170, no, there will be less cholesterol available for the production of testosterone, and so you'll be impotent. You'll be impotent. And then, of course, it has something to do with the life. What kind of a life, quality of life will you have? If you do not have, you know, I hope you understand me, if you don't have the sexual urge or the libido, no. Okay. And then they say that cholesterol lowering may cause a lot of depression. Now, there are studies that there is suicidal tendency for those who are frequently depressed. Number two, those who have low cholesterol are accident prone, maybe because of the depression also.
I see.
No, so this is the reason why I do not lower the cholesterol numerically or quantitatively. What I do is I just give something, usually a natural medicine, no, that would neutralize the bad effect of cholesterol, but not lower it down, because it's very important for our body. In fact, the truth is, it is a component of our cell membrane. All of the cells are made up of, the cell membrane made up of cholesterol. So why will you lower it when it is very important for the cell membrane?
Okay, we know that cholesterol is not the cause, but now I have another question. Why do the arteries harden and the veins do not?
Okay. You know, that is a very, very good question. There is a layer in the artery. You know, there are 1, 2, 3 layers in the artery. There is a muscular layer in the artery, while there is none in the vein. The muscular layer mutates whenever it is acted upon by a molecule or an atom like the free radical. It mutates. It causes migration. It goes towards the outside. Okay. So there is development of a hump in the artery. See, but the vein does not contain it. This is one reason. This is one reason. So, and this is the principal reason actually. No, so you will never see arteriosclerosis in the vein, but there may be blood clot.
Oh,
blood clot is not arteriosclerosis.
Right.
No, it can also obstruct the vein. But arteriosclerosis is the combination of the blood clot plus the plaque. Plaque, we call it in medicine as atheroma or atherothrombosis. That is the one that is like a stone, it's like a cement, no? Because the calcium deposition there is it hardens the deposit, no? And so it is not only a blood clot, but it is also a atherothrombosis. The thrombus part is the blood clot. Then the plaque is the atheroma. No. It produces humps and bumps in the arteries.
Okay. You know, we hear about arterial sclerosis all the time and or hardening of the arteries. You brought an interesting thing from the newspaper, and I don't know if we can show this. Can you see this on the TV or not? If we can focus on it or not. This is what the dam looks like after not having any water for a long time. This is in the newspaper today.
Because of the El Nino.
Because of El Nino. And Dr. Art tells me that that's what arterial sclerosis looks like.
Right.
That's what it looks
exactly.
like. Our arteries look like when we have arterial sclerosis. Thank you very much.
Actually, the artery should be very, very smooth.
Okay.
No. But if it is sick, no, due to the various causes of arteriosclerosis, which we can mention in a little while, it has a lot of cracks.
Okay.
Just like a rice field or a dam that has been dried for so long, and that is arteriosclerosis. So it's not only the hardening, it is also the narrowing, and it is also the roughening because of a lot of cracks in the artery. And you know, even in our early years of study in medicine, a surface that is rough, there will be more clotting. I remember we have an experiment wherein we drop blood in a glass, which is very smooth, and then a drop of blood in the sandpaper, which is rough. It's many, many times faster to clot in a rough surface. And that is actually happening with the blood inside of an artery that has roughening of its intima or its inner portion.
So we have the problem of clotting because of the arteriosclerosis.
Yes, and then hardening because
And
of
hardening.
the deposition of calcium, which is part of the healing process. That's why I said arteriosclerosis actually could be said as a healing process that has gone awry. No, the body does not realize, does not know that by repairing it with calcium, it would harden and it will make it very, very hard.
So when it gets these cracks, the body says, "Hey, we got to fix this."
Yes.
And it runs a bunch of calcium in there to fix it, and
Initially,
that hardens the arteries.
Initially, it is the various white blood cells. Then the fibrins. Fibrins means like hair-like structures to patch it. Then afterwards, to finally wall it off, to repair it, calcium will be placed in there. But then the body does not know that it will harden the artery, which is supposed to be pliable, pulsatile, and I would say very smooth. No? So that is what actually happens in arteriosclerosis. So I define arteriosclerosis as the hardening, narrowing, and roughening of the artery. And that is the culprit mainly. But the cause of this, as I told you before, is not cholesterol. There are many causes. In the conventional medicine, they considered smoking, diabetes, hypertension, obesity, sedentary way of life, not exercising at all, your gender. You know, we males are 8 times more prone to heart attack than females.
8 times?
8 times more.
8 times.
But when they become menopausal, we are 1 in 1. We are 1 in 1.
Why is that?
Well, it's like this. There are 2 theories, which is not only theory, but it's the most likely explanation. The female estrogen, while they are still fertile and have their periods, is protective of the artery. This has been proven. No. Number 2, the iron content of their blood increases at the time when they go into menopause. Normally, iron is thrown out monthly with females, but we men do not menstruate, so we do not throw iron. Iron is a cause in excess. No? Iron is a cause of hardening of the artery. This is a culprit. In excess iron, especially those who self-medicate, whenever they get dizzy or for whatever reason their blood pressure is low, they thought it's iron deficiency anemia. No, they would buy in the counter in the pharmacy iron preparation, and this is one contributing factor why people have arteriosclerosis.
Well, you know, 45 years ago, when a woman was pregnant, doctors gave them iron pills.
Well, yes. For
growing
children,
Yeah.
it is good. In patient with iron deficiency anemia, with not enough, that is good. No. People who have oozing ulcers or say oozing